Okay, Dan and Trish Defabbo in Lakewood.
Your husband had a high fever, so what happened after that?
Right, he had a high fever, and so I called my daughter, and she said, well, you need to take him to the hospital. So I called Fairview because I thought Lakewood was closed. I didn't think it was open anymore. But so I called Fairview, the emergency room, and told him, that my husband had a triple bypass and he was running a fever. Fairview emergency said, take your husband to Lakewood Hospital. And I said, but I didn't think they're open. And she said, no, their ER is still open, and there's a 4-hour wait for us, and he might not make it if his fever's going up that much. Yeah. So she really didn't know. She just said a man 70 with a high temperature is not a good sign. Yeah. So we took him to Lakewood. So I was really upset because my husband has a high fever and they tell me it's dangerous, and then they tell me to take him to Lakewood, and Lakewood tells me, yeah, we'll help him, but we're not really equipped to take care of him.
Were you able to drive? You were able to drive him to Lakewood.
Yes.
And you could have driven him to Fairview.
I could have driven him to Fairview, and I wanted to drive him to Fairview, but Lakewood sort of guilted me in, saying that if I was taking the chance of not being able to give him medical assistance if he needed it on the 3-mile drive. And I said, well, insurance doesn't cover the ambulance. I know, because last time you guys did this to me, I ended up with a $400 bill. And they said, no, the insurance will cover it.
So they wanted you to transfer him in an emergency vehicle.
Yeah, in a Donald Martin's ambulance.
They didn't want you to drive him there yourself.
No. And also they didn't know when the bed was going to be ready. Mm-hmm. So they ended up having a bed ready at 2 o'clock in the morning. So he was there with 8-9 hours.
So you took him to Lakewood Hospital?
It was about, I'm not really
roughly
sure, 4 or 5. And when Donald Martin's took him, there was no one in the back of the ambulance taking care of him. They just put him in there and drove him over. I would have taken better care of him and not charged $800.
$800? That's what the charge was?
The bill was, a little over $800. It was 3 miles, and they charged $14 for mileage. Oh, they charged $14 a mile for 3 miles, and then the fee for a non-emergency fee was $765. So that was the total bill. So
they were calling it a non-emergency,
So it seems like I could have taken him, but they told me I couldn't, that he might have I don't know.
And how much are you liable for on the transfer?
$300.
So it would have saved you $300 if there was no transfer involved.
Right. It would have saved me $300.
And they just put him in the back of the vehicle, no IV or anything.
Right. He had no IV or anything to go over.
And you could have just as easily transferred him in your own car.
Yes, I could have.
Yeah. So if there was a full-service hospital in Lakewood, the circumstances would have been different?
Yeah, we would have taken him there.
Mm-hmm.
They would have said, oh, we need to transfer him upstairs, and he would have stayed there. And they would have had the same doctors, because it's still Cleveland Clinic doctors.
Mm-hmm. And instead, you've got, your husband's got 103 temperature, and he's lying in bed wondering when he's going to be transferred. Mm-hmm. And, how did you feel as you were laying in bed there wondering when your transfer was going to
I wasn't feeling very good.
Were you able to get any rest in that time, or were you anticipating this transfer, wondering when it was going to happen?
I was wondering when it's going to happen, yes.
Yeah.
But it was based upon availability of the bed at Fairview.
Yeah. So it would have been a lot nicer. You would have gotten more rest if you were put in a bed that you knew you were going to be in and without the transfers.
Right.
Yeah.
Plus, they had more specialists at Fairview that could try and diagnose him.
Mm-hmm. The doctors at the ER in Lakewood weren't as skilled as the doctors that you would have at a full-service hospital.
Right. Right, exactly.
So that troubled you. that was
Yeah.
that was in the back of your mind the whole time. The idea that you're kind of in a holding pattern.
Yeah, and you don't know what's wrong with him.
Mm-hmm.
And
You haven't reached the final destination. You know you eventually have to get to Fairview.
yeah, and they, they said that high of a fever was not good. So, yeah, it was very stressful. Because as it was, he was in the hospital for almost a week, and yeah,
Yeah.
we're too big of a city not to have a hospital.
And I feel sorry for people that don't drive. What are they going to do?
Lakewood is a town of very diverse. We have a lot of older people. We have a lot of younger people. We have a lot of people that don't even own cars because we have such good public transportation. But we need a hospital.